Good morning, everyone. I hope you're all doing well and staying safe and sheltered and healthy. This coronavirus has changed a lot of things for Home of Hope, but we want you to know that we're here for you. So I've asked Kelsey Boyd, our intern at Home of Hope. Many of you have met her. We are just, going to go through a presentation that she put together, and it's a great topic, especially during this time when we're sheltered in place. We don't want you to feel isolated, but that kind of goes with the territory. And so we want to make sure that you have some resources and some things that you can be doing to help alleviate your anxiety and your stresses. So with that, Kelsey, I'm going to turn it over to you, and you can introduce your topic, and I will go to share screen when you're ready then, okay?
Okay. Yeah, I'm ready right now.
Okay, I will share the screen, and Kelsey, you can take it away. Do you see the screen, Kelsey?
I don't.
Okay, let me just double check here. Screen 2. Let's see, optimize. Let's see here. Where do we go with you? All right, let me see if I can pull it over, Kelsey, and
Okay.
if I can. Okay, can you see it now?
No.
Okay, well, let's see here. What about here?
No.
All right, well, now the last time we did this, see, technical problems here, audience. Please be aware that we are trying our best to get us into that. So let me just double check here. Share screen. One participant can. All right, I'm going to go over here. Select a window or application that you want to share. Oh, here, I didn't hit the share part. Now can you see it?
Yes. Okay. So my topic is expressive mindfulness, along with how that impacts trauma. So next slide.
Okay.
So I'm sure many of you are thinking, like, what is trauma? So trauma is defined as negative events that produce distress. So some potential causes can be human-made or nature-made. Like, for instance, many people would think of like war as a human-made cause of trauma. There's also nature-made, which would be like floods or earthquakes, tornadoes, and then the goal of Home of Hope is to have trauma-informed care. So the goal of that is to promote resilience and healing. It's not about what is wrong with the person, rather it's about what happened to the person. So the key principles that we long to have are safety, trust, choice, collaboration, and empowerment. Next slide. Okay. And then obviously trauma has a physical response, and this physical response triggers the fight or flight response in humans, which can lead to increased heart rate, raised blood pressure. It diverts the blood flow from the muscles, inhibits digestion, reduces appetite, increases blood pressure, and it dilates your pupils. So over time, this continued activation causes the amygdala to become hypersensitive and activates more easily due to external stimuli, which is why many trauma survivors are in a constant state of arousal. So next slide. And then trauma has long-term effects, so it can interfere with the rhythmic balance of the sympathetic and parasympathetic nervous systems. And it pushes the activation of the nervous system beyond its ability to self-regulate, meaning that the sympathetic nervous system frequently tends to get stuck on the on or off position. And then this can cause a lot of physical illnesses, such as like increased an increased chance of getting cancer and other illnesses.
Right, so our body, the way it's even worked out, the way it's designed, we need that flight or fight
Yes.
initiation, but when it's consistent with some either environmental factors or emotional factors, then that can get stuck on or
Yes.
off. Yeah.
And that obviously causes a big problem.
Right, right. Okay.
And then lots of people might not think that cancer patients or survivors get trauma, but that's actually not true. It's actually normal for a person with cancer or for a survivor of cancer to have feelings of anxiety, and these feelings might not go away over time. It could actually get worse or affect daily life, and this could be a sign of acute stress disorder or post-traumatic stress disorder.
Right.
And some aspects of a cancer diagnosis that might be triggering to the person would be like just the diagnosis in general, pain from the treatment, or from the cancer, test results, long hospital stays, or long daily treatments, or the fear that cancer might return or is actually already returned.
Okay.
So next slide. And if you believe that you've been struggling with any of these things that were previously mentioned, please contact a mental health professional to get an actual diagnosis.
Right. And you know, sometimes it's just a matter of talking things through too. So we want to let you all know that, you know, we're here to be with you, to talk through these feelings that you're having. And, you know, we're not going to diagnose you, but we're here to listen and to help guide you and even direct you to those professionals then that can.
Yes, definitely. So art therapy, it's a form of psychotherapy that uses art media as its primary mode of expression and communication. So there's no artistic talent necessary. The therapeutic process is not about the artistic value of the work. Rather, art therapy is simply about the process of creating without any judgment.
And I think that's really important. I know that we've had different programs before, Kelsey, you know, and I think we've had some patients, some clients even say, you know, oh, I'm not very artistic, but it's about really just being in the moment and being able to express yourself, what mood you're in or what you're feeling, or through the prompts that you've offered, you know, what triggers, you know, that to be a therapeutic then type of an experience for them. So
Yes, exactly. So art therapy has actually been found to encourage attention regulation, encourage body awareness and emotional regulation, lead to greater success with self-regulation, increase resiliency and quality of life, reduce stress, increase self-awareness and a sense of identity. It also allows clients to become more in tune to one's body and one's mind, enhance resiliency, reduce cortisol levels, facilitates a way of managing emotions, and also like creates opportunities for clients to effectively communicate through visualization. It creates healthy coping skills and offers an intervention for clients who are like in a wordless or nonverbal state as well.
okay.
It's also been found to be able to provide a way to validate choices of the client through the creation of art, allow the client to feel supported, it allows the nervous system to actually get out of fight or flight mode, increase the amount of communication in a therapeutic relationship, increase feelings of emotional control, help clients improve their interpretation of relationships, decrease PTSD symptoms by minimizing avoidance and dissociative symptoms and like numbing or flashbacks. It helps clients attach meaning to their traumatic memories and reflect on a new understanding of their experience, as well as improve their emotional states. And it can also improve attention and memory integration.
So Kelsey, I'll throw this out to you. I know that we had done a program a while back, but it was the, and you see them all throughout the stores, the adult therapy, the adult coloring books.
Yes.
And you know, I was thinking about that when you said that, you know, improving your intention or your attention and memory integration, but that just that feeling of relaxation, you know, being able to just like you said, be in the moment, expressing yourself. And it's just a personal thing. It's not
Mhm.
anything that you feel that this is going to be on display,
Yeah.
type things. So those types of resources are available and can be very helpful
Mhm. Yes, definitely. I definitely recommend any way of creating anything.
then. Hmm.
And then, so mindfulness. A lot of people might not know what mindfulness is, but that's okay. I'll let you know. So it's the physiological process of purposely bringing one's attention to the experience occurring in the present moment without judgment. So the goal is to train one's attention and awareness in order to achieve a mentally clear and emotionally calm and stable state.
Great. And this is something that we want the clients and their family members to know that we are going to be offering a
Mhm.
mindfulness-based stress reduction program. It will be coming to Home of Hope through the grant that we were able to get from the Coleman Foundation. And so please, for anybody out there that's interested in mindfulness, that this is something that we will be continuing on as one of the services programs at Home of Hope then.
So mindfulness has actually been found to reduce stress, cultivate a sense of well-being, and allows sensory and emotional input to come and go without thought or judgment attached to it. It can also cultivate a sense of self-identity, increase resiliency, deactivates the threat-based effect system, which leads to more like self-criticism. And then it offers oneself kindness as a way of like being able to heal and accept oneself. It offers more positive mental health for a person, and by offering more emotional regulation. It also has an internal composure, which still allows one to feel a range of emotional states, but not allow for their emotions to take control of them. So, in other words, they're less likely to get triggered by the things that have triggered them in the past.
I see.
Mindfulness also practicing it involves breathing, which has been proven to be an antidote for the fight or flight mechanism. It also helps to decrease heart rate, regulate arousal, prevent disassociation or hyperarousal, find safety within oneself, become less self-critical. It can help rebalance the parasympathetic nervous system and the sympathetic nervous system. It allows clients to take note of their emotions and physical state, and helps them create a better sense of intentionality. Clients who engage in mindfulness are more likely to less frequently, I guess,
Mhm.
um, experience rumination, which is like repeatedly
Yeah.
like repeating like
Hmm.
something in their heads, and report
Constantly
less.
coming back to them.
Yeah,
Hmm.
yeah, exactly. Like they just can't get away from some negative thoughts.
Right.
And it can also help like report less PTSD symptoms. So like it decreases anxiety, depression, emotional dysregulation, and post-traumatic stress, while also reducing inflammation and pain.
And I think, in our world, not just with cancer patients, but just through life in general,
Hmm.
I think really focusing, taking some time out to be with yourself, to have that time to think, to meditate, to breathe is a very positive thing. It kind of takes us off that hamster wheel that sometimes we feel we're constantly running on. And so for everybody, it's a good thing to really pay attention so that your mind, your body, and your spirit, because we all are interconnected, that we are able then to, you know, focus on that and strengthen those three aspects of who we are.
Yes, definitely. Like you don't have to have cancer or a mental illness to be able to utilize art therapy or mindfulness, for
Right.
sure.
Is that our last slide? Oh,
Oh no.
sorry.
Art therapy and mindfulness. So both therapies have been shown to be beneficial for clients who have experienced various types of trauma. And a word of caution, though, however, it did say that practicing internally focused mindfulness meditation can lead for some people who have experienced trauma to actually experience distress during that meditation state. However, it has also been found that utilizing a sensory or kinesthetic properties of like art materials and expressive movement can actually be harnessed to keep the individual like tethered to the present, which decreases the possibility for the client to become distracted or overwhelmed by the internal sensations that might occur when practicing traditional mindfulness meditation.
So it's good to have that, you know, that awareness that as you are delving in and being in the moment, that you also then, once you have spent your time with yourself, then to possibly, if you've experienced that anxiety, to reach out and talk to somebody about that possibly then.
Yeah, so it's like so if you've been a person who's experienced any kind of trauma from the treatments, you might want to do something else along with
Mhm.
doing your meditation. Like it might be art therapy, like I'm talking about now, or it could be like journaling, something
Sure.
that um, gives you a type of movement that keeps you
Right.
distracted while you're also being mindful.
Oh, okay, great.
Okay, so there's a lot of similarities between art therapy and mindfulness. So practicing mindfulness involves focusing exclusively on allowing sensory and emotional input to come and go without any thought or judgment attached to it. And similarly, to become engrossed in art, one must attend to its nature in a present focused manner, allowing for the suspension of concerns about the final product in favor of focusing on the fluidity or rigidity of materials and the sensation and textures encountered, the smells, the interplay of colors, shapes, and lines.
Hmm.
And then what I'm basically talking about right now is flow. So most people call flow being in the zone. So it's the mental state of operation in which a person performing an activity is fully immersed in a feeling of energized focus, full
Okay.
involvement, and enjoyment of the process of the activity. So art therapy and mindfulness combined is it is very common for people to enter a flow state when they're making art or when they're practicing mindfulness meditation.
Okay.
And then expressive mindfulness is just kind of combining the two. So awareness in the current moment is enhanced by the sensory experience of the materials, and equally, the awareness of the art materials is enhanced by the practice of mindfulness. So
Hmm.
the two appear to work together in like a circular approach.
Okay.
And then trauma-informed art therapy can be an opportunity to incorporate the core concepts of self-compassion, mindfulness versus over-identification, so like emotional regulation, self-kindness versus self-judgment, which is like perhaps based on past experiences, and common humanity versus isolation, so which is a natural reaction to trauma. And together with the cultivation of these qualities, it can support greater resilience. And then mindful art therapy has the power to act as a buffer against backdraft, which is basically resistance. And
Hmm.
since disassociation is a common type of trauma, mindful art therapy practices encourage the client to stay present in the moment and to remind themselves that they are currently safe. And
Right.
it can create a greater sense of safety with the client, and the client can better organize their memories and gather more self-compassion for themselves. Um,
Wonderful.
the inclusion of art therapy and mindfulness has also been proven to widely be successful in helping clients regulate their emotions and explore nonverbal ways of fostering emotional regulation, as well as create a more consistent narrative of their experiences through a visual representation. And the reaction of trauma symptoms found in the included literature support that mindfulness and art therapy are effective, healthy methods of treatment, and that the interconnectedness of both modalities work to improve emotion regulation, keep the client grounded in the present moment, and solidify long-term coping skills. And the
Mm-hmm.
integration of the two practices contribute to emotional regulation, resilience, and improvement of explicit memory.
So Kelsey, when people are going through and doing their mindfulness, or if they're wanting to explore art therapy,
Mhm.
is there a certain time, that amount of time that should be spent doing this? Is it 15 minutes? Is it 30 minutes? Is it an hour? Is it once a day, a weekly thing? What do you suggest?
I would say just try to take as much time out of the day for yourself as you possibly can. It might, just only be 15 minutes or so, but
Mm-hmm.
for most mindfulness practices, they normally encourage normally the longer the better, but
Right.
I would say anywhere from like 15 minutes to an hour would probably be the normal amount of time. If you
Mm-hmm.
could do more, then obviously feel free to do more, but you don't
Right.
necessarily have to.
So what I think, and we will for our Home of Hope clients and things, as we move through this new way of reaching all of you, Kelsey will be bringing on board some of maybe art therapy project, or our mindfulness program will be available. So we hope that you found this to be a worthwhile view and listen. We appreciate your patience with us getting things started off. And Kelsey, thanks a lot. You did just a great job. So very much
Thank you.
appreciate your expertise and your help. And I know that the Home of Hope patients and clients, their families, will look forward to the next program that we are able to put together then. So
Yeah.